Imagine needing a painful root canal that could have been prevented with a simple dental cleaning. Many people only go to the dentist when something hurts. For me, we get a lot of patients that call and say that something hurts really bad, that their tooth's broken off down to the gum line, and we'll ask them, well, when was the last time you had your cleaning? And the answers are typically 5 years, 10 years, sometimes 20, sometimes more. And there's no shame in that, but we also explain to them that the reason why we can't catch things early is because you're not coming in for your simple dental cleanings. We can't take the x-rays every 6 months. We can't check and see what's going on with the tooth. If we catch a tooth whenever it has a small decay, we can typically do a filling. And then the next step would be crown, and then after that is whenever we go into root canal, extraction, implant. If you were coming in for your dental cleanings every 6 months, we could take the x-ray each time you come in. We can see that there's small decay, do the filling. If it gets extensive, we can do the crown. But some people wait until the very last minute, and that usually ends up having to be root canal or extraction. We should all be scheduling our dental cleanups every 6 months. Regular dental checkups prevent a lot of problems. They will help find cavities early, and then the professional cleanings usually remove plaque and tartar. They prevent gum disease and tooth loss. According to the American Dental Association, regular dental visits help detect problems before they become serious, and prevention also saves money. Dental visits save money and protect your health. Small cavities are cheaper to fix than root canals or crowns. I'll say that a filling is probably $100 to $200. If you were to go into the crown area, it's probably about $1,000 to $1,200. Once you need a root canal, we're talking probably $1,400, $1,500, and then you have to have the crown on top of that. If you want to do an extraction, it is cheaper to do that, so we do get a lot of people that opt in to do the extraction over the root canal and crown, but then you're looking at missing a tooth completely in that area. Whereas if you do the root canal and crown, you're keeping that tooth, putting a crown on it, and it's still there. But sometimes a lot of people don't have the option. They'll wait till the very last minute, and they'll get the tooth extracted, have no bone there because the infection cleared it all out, and then they don't have any option but to get removable appliances like partials or dentures. Oral health is also connected to the overall health. The Centers for Disease Control and Prevention states that good oral health is an important part of overall health and quality of life. A lot of patients will come in, get the antibiotic for the treatment, and then the pain goes away completely. So they're like, okay, we don't need to do anything else after that moving forward, the infection's gone. Well, that's not the case. We always call an antibiotic a Band-Aid for the tooth because it'll make the pain go away, but it doesn't take care of the infection. A lot of people say that they're not going to come back for the treatment, they think it's all gone. Well, we've had a handful of patients actually have really bad health problems because they didn't take care of the teeth. And then they got mad at us because they didn't realize what was going on. They just think that we didn't take care of the problem, but they never came back in for the treatment. So what should we do? Take action today. Check your dental insurance, see what kind of benefits you have. If you can get a cleaning every 6 months, a lot of the times it's very common to get one every 6 months with your dental insurance, that's included. We also have patients that come in wanting a dental cleaning every 3 months because they really want their teeth cleaned a lot. That typically you would have to pay out of pocket for some of them, and some of them would be included. If you don't have dental insurance, you could ask about payment plans. I know the office that I work at currently, we do accept payment plans. We usually typically do 30, 60, 90. I used to work in corporate and we didn't have that option. They wanted you to pay for your treatment before you even left the building. Schedule your next cleaning before you leave your current appointment. It's a lot easier to schedule it before you leave because then you get reminders by text message or email, and it'll tell you, hey, you have a cleaning coming up in a couple months. They'll give you one the day before. I know ours is very excessive, and it texts you probably once a month, and then 2 weeks before, 1 week before, and then the day before to confirm your appointment. A lot of people don't like that, but our hygienists get paid by the hour and by the patient, so if you don't show up for your cleaning, it usually affects them. Or you could set a reminder every 6 months. Before the end of your semester, contact your dentist or visit your dental insurance website and schedule your next checkup. In conclusion, I would say that dental checkups prevent disease, they save money, they improve overall health. I think everyone should schedule their dental checkups every 6 months. 1 hour at the dentist twice a year can save you pain, expensive treatment, and keep you healthy. Make your appointment before the end of the semester. It would be a lot easier to make it every semester, since every semester is every 6 months. Thank you.